My name is Mark, and I have type 1 diabetes. I was diagnosed with type 1 diabetes on June the 1st, 1999, and I am a clinical health psychologist.
Hello, my name is Gabriella, and I've had type 1 diabetes since I was 2 years old. I was diagnosed on September 26, 1997.
My name is Jacquie. I've had type 1 diabetes for 23 years.
My name is Bob. I've had type 2 diabetes for about 6 years.
My name is Martin Wood, and I have type 1 diabetes.
I was diagnosed as a result of a checkup. I'd had some of the classic symptoms, but hadn't connected them with diabetes.
I was diagnosed with diabetes at the end of my junior year of college, and around that time I was trying to get all my papers and my finals and everything all done. I kind of pushed all those symptoms aside and tried not to worry about it too much because I was scared that if I had gone to the doctor, they'd tell me that I couldn't go to Paris. So I went to student health and I told them my symptoms, and they checked my blood glucose with a finger stick, and the meter said high. And I think that kind of freaked the doctor out because I don't think he knew what high meant. So he kind of pushed me in a chair and said, "Don't move." And before I knew it, there were paramedics in the clinic, and they were putting me in a gurney and wheeling me across the quad of my college to an ambulance. And everyone's looking at me, looking at this guy who's being wheeled across the quad on a gurney, wondering what's going on.
I was diagnosed with type 1 diabetes when I was 2 years old. Now, suffice it to say, I don't know exactly what my diagnosis story was. But what I do know is that for over 3 decades, I have lived through the ins and outs of life as a type 1 diabetic.
I have a very common diagnosis story. I just wasn't feeling well and lost a lot of weight, went through all the classic diabetes symptoms, and ended up in the emergency room with blood sugar around 600 or something like that, and stayed in the hospital for probably 2 weeks. But I had great care as soon as I was diagnosed, and I had a great doctor and lots of good supports.
Basically, my older sister already had it, and I was requesting a lot of water, and so my mom tested my blood sugar, and I was 486. Called the doctor and got some scripts and took it on from there.
I started to not feel so hot in the brain probably about 4 or 5 years later when I was 16 or 17. Again, I have a classic story with depression instead of diabetes. I just was tired all the time, cried a lot, felt guilty about a lot of things, and I didn't see the point of working so hard to keep myself healthy and alive when everything kind of felt so crappy.
For what I now know, I've been having depressive episodes since about the 8th grade. Finally, about a dozen years ago, faced with an episode that had become disabling and finding no help from my regular doctor, I turned to my employer's assistance plan, who in turn referred me to a psychiatrist.
When I was 11, I started experiencing some more than usual anxiety. I wasn't participating in school activities as much as I used to, and so at my pediatrician appointment before 6th grade, my mom took me in for my appointment, and I told my doctor that I was very anxious. I was a very anxious child, and I was diagnosed with OCD and generalized anxiety disorder.
In my over 3 decades of living with type 1 diabetes, it's rarely been that diabetes itself was what was keeping me from succeeding. The thing that wore on me from a mental health standpoint has always been everything else that you have to deal with. That, added on top of the responsibilities of diabetes, is what really seems to have the most impact on my well-being.
I'm not sure how much diabetes affects my mental health. Mostly just because it's hard for me to remember what life was like before I had type 1 diabetes. I can't really look back and say I was so much happier without this disease, but at the same time, I never really dealt with mental health issues before I had diabetes, if that makes sense. So it's definitely a factor, but I don't know if I can say exactly how it's a factor. I think it makes it harder because when you wake up every day and you feel crummy and you don't have any energy, the fact that you have to work that much harder just to kind of hang out and be alive and feel crappy is painful. It's hard to deal with, and it just doesn't seem fair when everyone else can feel crappy without going through all the same struggles that you have to.
We ended up finding out that I had disorder where my brain doesn't produce enough serotonin. This has a big effect on type 1 diabetes, but once we found the right treatment, I was able to really take control and live life to the fullest.
I don't feel like my diabetes has a big impact on my mental health, though I can't be sure. But the impact of a depressive episode on my physical self-care is huge. Exercise is harder because I have little energy and struggle to believe that it's worth the trouble. Eating right is harder because my sleep is disrupted and I want to eat to cover the fatigue. Everything about self-care is harder. If the episode becomes deep, they may become impossible.
My parents first sought professional help for me when I was still in high school, and I've kind of had to dabble in that ever since my first diagnosis with depression, which was probably in like 1995 or 1996.
My first meeting with a psychiatrist was amazing. The best thing of all was that the craziness my life had become, the sadness, the inability to act or make decisions, the sense of dread, even the inability to remember some words, made sense to him.
I found that once I found, a good doctor and so I just clicked with, my anxiety levels went down. Now I'm in college with straight A's, and who saw that coming? So you can do this.
There are a lot of psychologists and therapists out there who specialize in diabetes, and so find one in your local community who can really help you and who you connect with.
I'm a list person. It helps me to keep in check what my priorities are. One day my priorities might be to get everything on my work list done. Another day it might be to get a bike ride in, it might be to go for a walk, it might be to play with the dog. The thing is that a list helps me to keep a realistic priority of the things that I can accomplish during a day and the things that, frankly, just aren't that important.
I found that some techniques that help me with managing my diabetes and living with anxiety are to talk about stress points with loved ones or a counselor at school or someone like that.
When I'm in a depressive episode, I try to remember that my perceptions of myself and everything around me are unreliable, because depression lies. Most of all, I try not to let the depression tell me that it's going to last forever.
I think it's obvious to a lot of people that when your mental health is suffering, your diabetes care is going to suffer too. Just because you're tired, you'd rather just sleep. You don't barely have energy some days to get dressed. So you're definitely not going to have the motivation to weigh all your food and count things and write down your blood sugars. I just try to get through every single day when I'm not feeling well and talk to the people I know I can talk to and people who will understand.
A challenge of living with type 1 diabetes is the unpredictable nature of it. You can do the same thing 2 days in a row with type 1 diabetes, from eating the same foods to doing the same exact activities, and get two completely different sets of results. That's a big challenge, and it's also a big burden to carry around.
Mental health issues can affect people with diabetes in a number of ways. I think one of the biggest ways is that stress and other emotional issues can have a really big impact on your diabetes management and on your ability to control your blood sugar. This happens in part because when you're stressed, your body releases a variety of stress hormones, and those hormones can really wreak havoc on your blood sugars.
I've had one doctor sort of do the comparison between diabetes and depression and anxiety for me, and he said that, it's kind of something that you have to look at like the same way you take care of your diabetes as a lifelong struggle to kind of keep yourself healthy. That's the way that you have to approach mental health. It's not really something that you can ever just ignore. It's not going to take care of itself. You have to take care of yourself and make sure that you're getting enough sleep and exercise, and you're surrounded by the supportive people and the people who love you and people you can talk to keep yourself healthy. So in a way, it's very similar to diabetes, which is comforting, but also kind of frustrating and terrifying because we all know how hard it is to take care of diabetes. And you kind of think, okay, well, here's another thing that I have to take care of in the same way. So it can feel overwhelming.
Exercise definitely helps. Having me time definitely helps. Taking time away from schoolwork, away from work.
I think this conversation is a really important one to have, really because it shows people with diabetes that these experiences are really common. And although they're not pleasant, that other people are experiencing the same things that they're experiencing as well.
I don't know if I have any advice for people. I feel like I'm much more comfortable talking about diabetes than I am talking about mental health issues. I heard someone describe it once as you kind of feel like you're inside of a plastic bag and everyone else is on the outside of the plastic bag and you can't really reach the other people. And I think it's harder in that respect for people with diabetes and depression or anxiety, because that plastic bag is kind of your anxiety and diabetes. So you sort of have the double layer Ziploc plastic bag thing going on.
People in your life who are trying to help you really want to help, but sometimes they just don't know how to offer the right type of help and support for you.
Just carrying the burden of life with diabetes is a very important skill set to learn. You have to know when to sometimes obsess over the details and monitor things extremely closely. And you also have to learn how to let go a little bit and have fun and have those days that you're just going to refuse to have diabetes. To match those days when you know that it's part of you and it's a part of who you are. And that's okay, because you're very good at it and you learn to be very good at living life with diabetes. I've done it for a long time now. And if I can do it, you can do this too.
I would say you're not alone. I hope that helps. I know it feels like nothing does sometimes.
Definitely reach out for support. Go to a school counselor, or search out a counselor in your community. With the right treatment, you can succeed and do anything. You can do this.
Take one day at a time. Diabetes can become really overwhelming sometimes, but don't get too overwhelmed with the big picture of your mental health. I think focus on today. What can I do to make myself feel better today? I think one of the most important things that you can remember is that you can do it. You can do this.
Realize that we're all too hard on ourselves sometimes, so just try to take it easy on yourself. I wish that you didn't have to do this, but you can do this. I did it. I'm still doing it. So you can do this too.
Brighter days are coming. You can do this.